Hi, welcome to video 55 of Staying Healthy in the COVID epidemic. Today we're going to discuss about the why less people are dying from COVID-19 in warmer countries. So a lot of people have asked me this question and I thought of doing a video to summarize the reasons behind it. So COVID-19 pandemic is affecting all countries in the world. However, except for few exceptions like Scandinavian countries, like but they have the very high serum vitamin D level because they eat regularly fatty fish. And then the Iceland and New Zealand are the two examples where the female prime ministers are running the country and they did a fantastic job in control the disease from the day one. The highest death rates are in the countries with a colder climate, like US and Northern Europe, especially in United Kingdom and Northern Italy. So these are compared to the countries with a warmer weather and equatorial countries, especially those countries that are located within 1500 kilometers from the equator. The latter countries include, but not limited to, India, Pakistan, Singapore, Sri Lanka, Malaysia, etc. So this also brings for me to discuss briefly on this phenomena is going to affect the southern hemisphere countries, like especially the southern part of the South American countries. Now that these countries are heading for their winter, therefore, even though they had a relatively lower incidence so far during the summer, these incidents are very likely to go higher with the higher death rates in these countries. Again, another group of examples is Africa in general, as well as countries like Cuba. It's very warmer weather. They have a little incidence of COVID-19 so far. Historically, case studies had previously reported the SARS outbreak in multiple cities suggested that the disease spread and indeed the severity, therefore the deaths, was significantly associated with the ambient room temperature. In addition, low temperature and low UV radiation index, so-called UVI, are also associated with the infectivity from all respiratory viruses. This especially has been reported in multiple times in Northern Europe and United Kingdom. Moreover, there are other variables including weather, including the air pollution, which is very important, also positively influencing the incidence of influenza. Higher the air pollution, lower the UV rays, UVBs reaching the Earth's surface, therefore lower vitamin D, lower immunity, and people get sick. So previous studies reported that the lower ambient temperature are associated with the higher incidence and spread of all respiratory viruses, whether it's upper or lower respiratory tract, including influenza, SARS, etc. The effects of the weather, especially cold and drier air, increase the spread and the survival of coronaviruses and other respiratory viruses, including COVID-19. This correlates well with the availability of less sunshine and thus the low ultraviolet indexes and the air pollution as mentioned. So again, this also coincides and goes parallel with the peaks of influenza and COVID epidemics happen in the Northern Europe. Whereas other studies, very few studies have found such association between COVID transmission and temperature they were unable to duplicate. Whereas several recent publications predict that as the summer approaches, the COVID-19 pandemic will subside in the northern latitude countries with increasing ambient temperature in these colder countries. With higher temperature, with higher humidity during the summertime will reduce the viability and the spread of COVID-19, which is a natural phenomenon. It has nothing to do with the healthcare delivery of any country. However, considering the pattern and the rapidity of the spread of tropical countries in March through April 2020 suggested otherwise. Nevertheless, The recent wave of COVID-19 infection in warmer countries, especially in Australia, was the mostly affected the housebound older people with the multiple comorbidities. The younger generation and the healthy adults were really affected. In fact, more than 95% of those who died within the first wave of COVID-19 in these warmer countries were the group of people who are older than 75 to 80 years old with a lower immunity and very, very low serum vitamin D levels. So it has nothing to do with the healthcare. It is purely due to the immune situation, immune system strength, and it's a natural deaths due to poor immune modulation. Cold and drier winter weather is also helped to facilitate the COVID-19 spread. Considering this, enforced or voluntary social distancing, contact tracing, and human quarantine are, although standard public health measures implemented to prevent infections and the flattening of peaks, including in the case of COVID-19 infection, while important, it is not the main reason why the warmer countries has less incidence and the lower death rates. Nevertheless, in public health point of view, the priority should have been for self-quarantining in their own homes with the supervision from the PHIs rather than the group or so-called herd quarantine in centers, which is inhumane and unethical. In public health crises, such maneuvers are intended to prevent overwhelming healthcare system overloading and thereby reducing the mortality. The current approaches related to locking down cities and states or the countries in some draconian measures of 24-hour strictly enforced countrywide curfews for months at a stretch are totally unnecessary, worthless, and only causes further misery to people, harm the economy and the livelihood of public, with very little gaining control in the COVID, even though the administration maybe think otherwise for their own glory. The latter has also led to impairment of mental and psychological health of millions of people significantly, and some people is permanently harm their this psychological and physical health. And also, as I mentioned in a minute, it also markedly increases the mortality and the deaths of vulnerable people. For example, it is estimated that for each PCR positive COVID patient, this is through the global number of global studies, there will be in excess of uncountable 1,000 community deaths due to curfews. The latter is due to complex processes that includes, but not limited to, lack of essential medications, inability to get timely medical attention, starvation due to lack of food, access to food, illegal alcohol abuse, which is a major problem escalating in some countries, brutalities, mounting psychological stressors, social isolation, cumulative stressors, and associated economic failures to support the families, leading to significant peaks of suicide are yet to come. Yet no one seems to care about these tragedies affecting the community and the people in general, or going to be accountable for. But people should ask the question, why such large number of people are dying in the community now? In summary, the lower number of COVID positive cases are much misleading. These numbers are simply due to insufficient testing. If you do less testing, you'll identify less patients with the COVID. There's no brainer in that. Even in the hospital system, those who are admitted with some symptom of respiratory failure, especially in the elderly, the COVID testings are not being done. I have the first-hand information on this one, which is really worrying situation. In worst-case scenario, that no testing is done in the community in these mentioned countries, which is insane public health point of view, and one of the major public health and policy errors of the health departments. Such is apparent apparently doing by those administration want to keep the numbers low of the publicly informed infected people as suggested by some. Based on the community testing data from multiple countries, it's clear that for each COVID positive case, there will be between 10 and 40 additional cases or PCR positive asymptomatic carriers in the community that gradually and continue to spread the disease. None of these things appears in the governmental statistics of any of these countries because they do not test community testing, whether it's a PCR or antibody testing. According to these calculations, in India, for example, the number of COVID-infected patients to date at the middle of May are likely to exceed 1 million already. Although the reported numbers, you see that not even 20% of that. In Sri Lanka, for example, there could be up to 40,000 people infected in the community, but not knowing that they are infected, because most of the people have a reasonable immunity and they may or may not develop any signs and symptoms of COVID. But yet, they are infectious and they can spread the disease to others. It's also becoming apparent not only community but also the hospital deaths due to COVID-19 are not properly documented in death certificate due to a number of reasons, some of which are not clear to me. If this is the case, even the number of deaths reported can be misleading. So overall picture, what we are getting from some tropical countries in particular cannot be relied upon. In addition, the lower number of reported deaths has nothing whatsoever to do with the healthcare delivery system in these warmer countries. In fact, 10 to 40-fold differences in the number of hospital ICU beds per capita or GDP, or for the number of doctors per 1,000 or 10,000 population, whatever the measures you look at it. For example, comparison between the Bangladesh or Singapore has a 40 to 60% better healthcare system in Singapore. Yet the death rates are uniformly lower in these countries. Again, suggesting that healthcare systems has very little to do with the incidence and the death rates of COVID-associated issues in these countries. The reported low death rates are exclusively due to the availability of the plenty of sunlight and summer-like warm weather, minimizing the spread of COVID-19. Relatively light skin color of these people in these countries, not a dark skin like in Africa. The combination of warmer temperature, drier weather, and relatively better immune system of the people in these tropics compared to those in colder climate is the key reason why the incidence and the death rates are lower in tropical warmer countries, as I mentioned before. Moreover, reduction of the incidence is greatly facilitated by the relatively lower number of people traveling in these countries and compared to air travel. For example, the air travel compared to U.S. in India, Sri Lanka, Bangladesh, Pakistan are less than about 5%. So how can you compare a country like US or UK or Europe with these countries? It's a non-starter and insane to compare the statistics of Western countries with the marked dynamic system with the tropical countries I mentioned. For example, in Sri Lanka, there's only one international functioning airport. When that was closed in mid-March, there was no further influx of COVID patients to the country. This is in comparison to US, some people asked, there are over 5,000 airports, and none of these airports were closed due to the entire COVID-19 epidemic. Now you see the difference. Each day, more than 150 to 250,000 people travel. And that wasn't subsided because of the COVID pandemic. Whereas countries like in India, Sri Lanka, the transportation system totally stopped and paralyzed. Therefore, there was no possibility of spreading the disease. Considering these, the shutting down district, prolonged curfews, and the healthcare system highly unlikely to have any meaningful effect on the controlling COVID-19 epidemic not only the mentioned countries and all tropical countries, including Sri Lanka, India, Malaysia, etc. In addition to the erroneous statistics that I described above, the reported low prevalence and death rates are simply due to the natural reasoning, the weather, and has very little to do with any other manuals, irrespective of how sophisticated they are by the administration, including the draconian actions of 24-hour curfews, which are totally inappropriate and unnecessarily control viral epidemics like COVID-19 pandemic. So I suppose I answered the question to the many questions raised by a lot of people why tropical countries, the death rate and the incidence are low. Because simply due to the warmer weather. Perhaps the global warming also might have even helped a little bit for these countries. So the next video I will discuss the disease prevention strategies using exposure to sunlight and what will be the supplementation in a little bit more detail than I described in the past. Thank you again. I hope you will subscribe to this channel pressing the red button. I'm Professor Sunil Wimalawansa, I'm Professor of Medicine from New Jersey, United States of America. Please join us again. Thank you.